Good afternoon and welcome. Welcome to the 2020 Impact Festival. I'm Ligia Teixeira, the founding CEO of the Center for Homelessness Impact and your host for today. Over a period of 5 weeks, the Center, alongside our partners and collaborators, are creating a space to meet, explore ideas, learn new skills, and to build a shared sense of what we want to achieve in homelessness over the coming months and years. Today marks the beginning of week 4, which is dedicated to the theme Resilient Relationships. This afternoon session, titled Using Data Rapidly to Tackle Homelessness More Effectively, will build upon that theme by exploring how leaders across all levels of government can improve results by using data and evidence even better. We know that each year, governments at both local and national levels spend a huge amount of money addressing homelessness, but in most cases, we have no idea how effective this spending is. Performance is not always assessed, and measurement tends to focus on tracking the numbers of people served and the amount of service provided rather than the outcomes that are achieved. At the same time, tight budgets cause us to underinvest in prevention, even when we know that doing so will lead to greater spending on recovery services down the road. COVID-19, of course, is making a very difficult situation even more challenging. Better use of data and evidence can help, but change, of course, isn't easy. So to help us explore these very important questions, I am thrilled to be joined today by two fantastic speakers. Welcome, Jeff and Neil, and welcome to everyone joining us online. Thank you for making the time to be with us today. For any questions that come up as the session goes on, you can post them into the Q&A box at the bottom center of your screen, and I will put them to the panelists to answer at the end of the session. The hashtag for the festival is CHIFest2020, so please get involved with the conversation on Twitter as well. First, we will hear from Jeff Liebman, leading American economist, of course, professor of public policy at Harvard Kennedy School. He also worked at the Office for Management and Budget during the first 2 years of the Obama administration. And keen to remain close to policy developments, Jeff and the Harvard Kennedy School Government Performance Lab have been providing support to state and local governments in the US, interested in improving results for all their citizens. And partly informed by his work and obviously these experiences, Jeff has been advocating strategies which combine a focus on rigorous evaluation with an approach that uses data at a much higher frequency to improve the administration and impact of government-funded social programs. So Jeff, it's a huge pleasure to have us with us today. Welcome, and I will hear from you first and look forward to your presentation.
Great, thank you so much. Let me start with an example, and then I'll take the level up to theory a little bit. My team was working on a project with a state government in the United States that was delivering child welfare services, services for families where the parents were neglecting or abusing their children. And the way this agency worked is there would be a caseworker that would be assigned to each family, and the job of the caseworker was to figure out which services the family needed and refer the family to services. But the training wasn't so great for all of the caseworkers, so it was a little idiosyncratic what services families got connected to. And often when a caseworker went to connect a family to a service provider, there weren't any slots available with that service provider. And so instead of connecting the family to the most appropriate services, they would essentially connect the family to whatever services happened to be available and have slots available. So it comes to the end of the year and it's time for the government agency to procure services for the following year. Well, what you'd want them to do is, of course, procure the best services, and in the cases where there were shortages and excess demand for services, to procure more of those for the coming year. But the agency didn't have any data on when there'd been a desire to make referrals that had been, where there hadn't been any slots. All they had for data is which services were actually paid for last year. And so year after year, they simply procured the same mix of services that they'd procured this previous year without any rebalancing. The reason I started with this example is, in some sense, the activities that need to happen here to connect a family to services are four what sound like very simple steps. Figure out who you're trying to serve, segment that population into families that need different kinds of services, purchase that service mix from social service providers, and then make effective handoffs so that the families actually get to those services. But despite the logic and the simplicity to the logic of what is needed here, we see time and time again in our work with local governments in the United States that no one's thinking about any of these steps. Basically, no one has the job of figuring out who the population is that's being served and trying to get better outcomes for them. Someone has the job of making grants for one kind of service. Someone has the job of taking a particular client and figuring out what service they should get. But no one is in charge of purposefully moving the system toward better outcomes, or even calculating the most simple numbers, like what % of the families we were trying to serve showed up for services. And so without anybody in charge and without any measurement, basically we just keep delivering services and without any kind of strategy toward improving things or getting better outcomes. And then we wake up every year and say, guess what? Our homelessness problem is just as big as it was last year. Our addiction problem is just as big as it was last year. Our joblessness problem is just as big as it was last year. And no one is on the hook for having failed, because it was no one's job actually to try to move the system as a whole toward any of these outcomes. And so we just sort of keep doing what we're doing. What we've seen with our, I think we're up to now 112 projects around the United States that we've collaborated with local governments on now, is that if you purposefully measure these steps and actually try to get the percentage of families who need services that show up actually to do it, you can double the percentage of families that get the services. If you sit down and say, actually, what service mix do we need next year? Not what service mix did we buy last year, you can rebalance services. And so we've seen that some pretty basic systems redesign work where the data analysis is basically dividing one number by another and saying what % of people got through some step of a process can lead to much better service delivery and outcomes. So point number one is, when I look at the fact that we haven't made enough progress on difficult social problems, I mostly think it's not that the problems are unsolvable, it's that we actually haven't really tried. We haven't strategically said, let's figure out what it's going to take to get to better results, and then gone through those steps and measured our progress toward those steps. Second point I want to make is that a key element of better service delivery is having government agencies collaborate more effectively with service providers, where the government and the service providers get together at high frequency every couple of weeks, every month, look at data together and steer the oars in a joint way toward whatever outcome they're trying to achieve. That is so unusual in the United States. What usually happens is the government writes a contract with the service provider, gives them funding, and then it becomes a compliance exercise. Let's check off some boxes, and as long as you don't break any rules, we'll give you your money. Meeting at a high frequency basis to actually say, how are we going to improve services and outcomes? It's very rare, but when it happens, you again see spectacular improvements and results. Twice as good results as you were getting before. We frequently see as we do this. So with those sort of two ideas on the table, let me just describe two homelessness-related projects that we've worked on and that apply these concepts. The first was with the city of Denver. Denver is a city, mid-sized city in the United States, which means it probably has about 1,000 chronically homeless individuals who are in and out of shelters or on the street. Denver's a city where there was where new housing was really tough to come by. So you sort of when you think of providing housing for the homelessness, at least in my simplistic view in the United States, there are cities where acquiring the housing is pretty simple. And there's cities where you got to build the housing because there is such a shortage of housing, you can't just go find it very easily. Denver was definitely in the second category. And what was going on in Denver is it was clear that there were a lot of individuals who were going back and forth between jail, homelessness, behavioral health services, and just cycling in and out of jail and the streets a lot. And those folks were being very expensive to the systems because they were using the jail, they were using the healthcare facilities a lot, and they were having bad outcomes for themselves. And so what Denver decided to do is take the data on homeless individuals and on people who've got in and out of jails and identify the 500 or so people who had been in and out of the jails and the emergency rooms and the mental health facilities the most, and make a purposeful effort to provide permanent supportive housing to them. And so they made a list of the individuals, and then when any part of the system encountered one of those individuals, whether it was the police or the emergency room, they said, this is a priority individual, we're gonna prioritize them for permanent supportive housing. And at the same time, they built a bunch of units, 330 units of permanent supportive housing that could be used to house these individuals. And they systematically, over about a year, got these 330 individuals housed. It's now a few years later, about 80% of them are still housed in the permanent supportive housing. About 20% have transitioned sometimes to new housing, sometimes to less successful outcomes. But with a purposeful effort, they actually were able to house the highest utilizers of these various systems and people whose outcomes were almost certainly going to be very poor because of their cycling in and out of inappropriate institutions in the street, and get them housed. And by doing that and getting the sort of high utilizers under control, it made it easier to streamline the rest of the homelessness system and focus on, for example, people who needed less intensive services to stabilize their housing situations. So that's an example of the system, the people in charge of the system saying, let's not just keep doing our jobs the same way we've been doing it. Let's actually decide we're purposefully going to do something different and actually house people, and they were very successful. The other example I want to give is from Seattle. Seattle is probably the city in the United States after Los Angeles and New York that has the biggest street homelessness challenge. And it also has some of the most generous services for the homeless population anywhere in the United States. And despite spending a lot of dollars and spending, I think over about a 10-year period, there was a something like a 60% increase in spending on homeless population in the city. Despite that, they were not having the outcomes that they wanted. In particular, they were continuing to have a very large street homeless population. And when we got involved, they were asking for help figuring out how they could get the system more focused on, and all the players in the system more focused on the question of how you actually move people from homelessness to stable housing. And when we started working with them, they had 60 providers that the city was contracting with of various kinds of homelessness services, from shelters to behavioral health services to street workers and the like. And these 60 providers had a collective 176 contracts with the government. And many of them had 5 or 6 different contracts with one provider. And what was happening was the government agency was drowning in all these contracts because they had to do change orders and invoices and audits. And so they couldn't spend any time thinking about strategy or performance. All they could think about is the compliance activities of issuing the contracts and making sure the contract terms were met so that they could make payments on the contracts. In addition, because there were the multiple contracts with each provider, it made it very hard to rebalance the service mix because the contracts were very rigid. They each contract provided for a specific service, and you couldn't say, listen, even though you have 5 contracts with us, we want you to spend twice as much on this activity and half as much on this activity. without reissuing the contract. And so that again was just very unwieldy and taking up all the time of the government staff, and they weren't rebalancing because it was too much work. So what we helped them do was two things. One was to consolidate contracts so that the large number of individual contracts, again, often multiple contracts with each service provider, was reduced to one or two with each service provider, with much more flexibility on how the money could be spent to adapt to the need. And secondly, and I think most importantly, we helped them put consistent performance metrics in each of the contracts. So before we got involved, they did have performance metrics, but they were metrics like what's the total number of showers delivered in a homeless shelter, which isn't really the outcome you're trying to drive the system to, giving lots of showers. You're trying to drive the system presumably toward stable housing for individuals. And so we helped them introduce into all of their homelessness contracts a standardized set of metrics all around of the people you're serving, what percent made it to stable housing, what percent were still in that stable housing 3 months later, what percent of those folks hadn't returned to homelessness over a year, a couple other metrics in addition. But basically, make sure everyone in the system was steering toward the same direction, which was actually getting people stable housing, as opposed to measuring things like how many people are in shelters. And you know, I think I wish I could say that the end of the story is Seattle doesn't have homelessness anymore. There are a lot of challenges in that city, but I do think the system has been able to be much more strategic because the government now has a way to have conversations with the provider community, and they come together every month and every quarter to look at numbers for the whole system about what percent of people have in fact transitioned to stable housing, what percent of the people who transitioned to stable housing have remained there, that allows them to all have conversations and be aligned toward the same objective. So that's an example of the second point I was making, that the government and the service providers need a way to have regular conversations around metrics data so that they can all be rowing in the same direction and spot opportunities for systems reengineering to get better outcomes. So why don't I pause there and let us go into the conversation part of this.
I think I lost you there for a second, but back now. So thank you so much, Jeff, for that. And before I hand over to Neil, one of the things that might be useful to explore briefly is, you know, the right balance between change that happens at local level and how you might scale those lessons at pace across a much bigger geographical area. So for instance, the work you did in Seattle, what would there be appetite to do that across more cities? So if you manage to standardize across an individual area, how might that then happen across more states in the US? It's a constant tension here in UK of, you know, how can good practice in a particular city then scale fast, and to what extent to standardize but allow also for individual, flexibility and creativity?
Yeah, it's a great question, and it's one we struggle with, because it's wonderful that we helped Seattle, but we'd like to help every city move in this direction, and it's a slow process. I think of this as sort of having three components that the spreading work. One is at the local level, spreading these ideas, having governments that have already done this coach ones that are looking to do this. In fact, when we wrapped up the Seattle project, we put on an event and we invited officials from 15 other cities to come here, not from us, but from the city folks in Seattle who had done this work. So you can make some progress simply by deliberately spreading ideas and coaching. And if you go on our website, you can see exactly the metrics we created for Seattle, and some other cities have adopted those same metrics and haven't had to reinvent them. So one can certainly make progress that way, and we do a lot of effort to try to spread ideas that way. But as you say, it's slow progress when you just simply try to get ideas to spread. And so I think there are two other things that often help spread ideas faster. One is when the central, the national government decides to create financial incentives for ideas to spread. That can be very powerful and can reinforce simply the ideas spreading themselves, especially if there's money attached for governments that want to try something innovative, for local governments that want to try something innovative. The other way things can spread is if service providers grow and expand. And I mean, it's a sort of funny thing in social services how fragmented and local service provision is. It's very rare for one provider to run homeless shelters in even 5 different cities. But in some parts of social services, you do see providers who've sort of figured things out expand into multiple jurisdictions in the US, multiple states, and that can be a way that best practices can spread as well.
Thank you. And obviously we'll come back to you very shortly. And now we go from Boston to Newcastle, and we will hear from Neil Munslow, who is the Service Manager, Active Inclusion for Newcastle City Council, where he's worked since 1989. And Neil is responsible for the coordination and delivery of services in Newcastle that provide the foundation for stability. And he sees that as obviously an income, a home, financial inclusion and employment opportunities. Neil chaired the Eurocities homelessness group between 2009 and 11 and has been involved in several European and UK government consultations and reviews. He was awarded an MBE for services to local government in 2011. Neil, by international standards, it's fair to say that you've already ended most types of homelessness in Newcastle. So what remains to be done, and how do you think some of the strategies proposed by Jeff can help?
Yeah, thanks, Lygia, and thanks, Jeff. I think you're exactly right. It's an understanding problem. The better we understand a problem, the better we can solve that problem. And at present, we have a very low number of people literally homeless in Newcastle. Down to this morning, there was one person, and that person will be offered accommodation today in terms of acute rough sleeping. But we estimate of a city of around 300,000 that there's potentially 40,000 people who could be at risk, predominantly due to poverty. That's the main cause of their risk. And I think I was really heartened by a lot of what Jeff said and how much it chimed with the things we try to do, and the overarching the spreading idea. I think one of the big catalysts for us was we got just under £1 million from central government in 2017 to run a homeless prevention trailblazer programme. All the information on that is on our website, and that helped us to better look at our challenges, and particularly the idea of having dialogue with our providers on a regular basis. So in 2002, government said local authorities in England had to have a homelessness strategy based on understanding demand and the effectiveness of resources. And 18 years on, we're still trying to do that. About 8 years ago, we started realizing that we had to have much more frequent dialogue, because the requirement for a strategy is every 5 years, and it's just too long. So we have quarterly reviews led by our politicians that bring our providers together. And that's led to a lot of the things that Jeff described when he was describing the rationalization of contracts. We had 27 providers, each with their own referral forms, each with their own systems. We now have 2 consortiums of providers and 1 referral system that helps us to see a problem. I think the emphasis that Jeff had on using metrics as a means for discussion to understand and deal with a problem, rather than necessarily, particularly in complex lives, that there's a button you press that tells you everything about people. So we have an approach that we would call proportionate partnerships. So for some people, like last year, we had 69,199 people that used our web-based information as a means to resolve some of their problems. 22,920 people who received welfare-related advice, down to 350 people who would get a multidisciplinary team response. And it's those proportionate partnerships, bringing partners together, and where the problem is complex, to try and resolve some of those challenges that we see through fragmentation by case conference type approaches of coming together to bring our resources together for those people. I think Jeff's description of the false positives that come from data, if your data isn't designed to deal with your problems, you have to keep refining your data so that it better helps you define your problem, because particularly in an issue like homelessness, for some people, their issue is simply an accommodation shortage, and that can be solved. Our Stable Life acronym is about somewhere to live, and income, financial inclusion, and employment, because since the welfare reforms in England, now there isn't just one cause, there's conditionality and interrelated problems. So you need to understand the way that those problems relate to each other, and then bring services together to meet more complex needs. Because and our biggest failing has often been that recycling people, accommodating again and again, rather than refining our offer. And that's looking at that, and as Jeff says, coming together has allowed us to better test what works and what doesn't work. So particularly, I think examples, poor quality accommodation, hostel accommodation, shared accommodation, all of those things had a big impact on the loss of accommodation and recycling people. In 2008, we got rid of all shared rooms. And then in 2011, we opened a purpose-built accommodation, and the results are so much different when form follows function. It's designed to work with it. Changing policy and approach, particularly with the landlords, one of our biggest successes, and I think using data to identify the headline problem and then coming together to solve individuals' problems, is a 75% reduction in evictions from our 26,000 council homes down to 1 eviction a week. And we've just agreed a policy that nobody's going to be evicted into homelessness, because when numbers are so low, then you can have bespoke solutions for individuals. And it's feedback loops, and not having success in one part of this system that's detrimental to the whole. So for one of the skewing effects of the UK funding system is that there's a perverse incentive for maximum occupancy, which reduces capacity to respond to crisis. So we accept that and build in some headroom so that we can respond to crisis. Otherwise, people will be homeless because we haven't got the space, because people are working towards two systems. So it's recognizing the complexities within systems and then locally designed solutions. And I think in relation to your question, Licia, I think that having, because the variables, certainly in the UK, are so different, Westminster might as well be Rio de Janeiro as Newcastle. It's so different what the problems face there. But the principle of understanding your demand and relating it to your supply and continual refining can be applied everywhere. And then it becomes political choices as to how you respond. And I think Jeff mentioned it a few times, and I have this as my last point, having definitions that work locally and metrics that relate to your values. So suitable and sustainable accommodation, rather than just responding to crisis, because metrics and performance indicators, people will follow them. And if they're wrong, you will get more of the wrong things. So if your response and you're designed around, we only respond to crisis homelessness, you'll probably get a lot more crisis homelessness because that's what you fund. If you skew your measures to suitable and sustainable and long-term measures, hopefully you will get more of those. We've got a long way to go, and I'll definitely be looking at Jeff's metrics in Seattle. So Is that okay for a response?
Thank you so much, Neil. And before we open to the floor, one of the things that I'm thinking about is missing data. Because I don't know about you, but certainly we come across many cases where people do use data, but usually it's just the data that's in front of you, right? From the people using your services, as opposed to the many people who might either not coming to you or come to you and then essentially quickly disappear. What strategies would you recommend people use to always bear in mind missing data when defining potential success measures? Jeff, would you like to start?
Well, my experience is one doesn't have to get very fancy. You know, you don't have to sit there and wait for some new integrated data system before you can go start measuring what you need to measure. If you just get the right people talking to each other and sharing Excel spreadsheets, you can almost always measure what you need to measure. You do have to get the lawyers to get out of the way and say it's allowed, which, you know, but once you solve the lawyer problem, you know, this data analysis, you know, I'm an economist. I love, you know, I love talking about predictive analytics and machine learning and all that stuff, but you don't need any of that. All you need to do is divide two numbers. There's a base of how many people you're trying to help, and there's a percentage who got through some step in a process, and graph a time trend of that. And 90% of the time, that's what you need to be able to come up with the operational insights to improve the system. You know, I will say the one place in homelessness where it has been pretty challenging on the data side is there's some jurisdictions in the US that have passed laws saying that homeless individuals don't have to give their actual names when they sign up. And so then it becomes very hard to say measure to the health, match to the health system's records or do things. But most of the time, it's the data obstacles can be overcome with a little bit of grit and determination, is my experience.
Neil.
Yeah, I mean, who would argue with that? I think it's right. And if you get the larger data right, yeah, on volume, that then provides those opportunities. So when we reduced evictions from, and when it's down to a small number, the data becomes less important. And I think for quite a while, we maybe, at a sort of analogy, maybe we sometimes looked through the wrong end of the telescope. So we were looking for small answers in big data and for specific individuals and responses. But when I think you need sufficient data, particularly to be able to justify your costs in political systems that relate to your larger numbers, and to continue to refine that and to use your gaps to your advantage. If there are unanswered questions and they're of sufficient size, then you need to do something about your bigger data. But when you can pull it down, because these are invariably individualized problems, and then you need individualized responses. And if the response works, you don't necessarily need to record every aspect of what works. It's that consensus. And I think particularly involving the person who's affected. If they're not involved and everybody else has got an idea of success, then maybe it's not quite so successful. I think, yeah.
Thank you. And Jeff, one of the things that obviously marked the Obama administration was the fact that, you know, he was a big champion of evidence-based policies, which no doubt is part of the reason why you ended up working in his administration. And what would you say at federal government level or at central government level, what are the 2 or 3 things that can make a huge difference when it comes to, from the center, really pushing these new types of habits and types of investment?
That's a great question. I think the thing that was most successful in the Obama years was something that my colleague Robert Gordon at OMB really spearheaded, and he's actually now the Secretary of Health and Human Services for the state of Michigan. And what he figured out was if you took existing spending programs, and then when the federal government gave out money, you segmented the funds so that some funds were available to programs with the greatest amount of evidence that they were successful. Some funds were allocated for unproven but promising innovations. And some were sort of allocated for things in the middle that seemed like they had some evidence, but really needed to, but were committed to generating more evidence. You could create a innovation cycle where everyone was trying to generate more evidence to become eligible for the higher amounts of funding that were eligible to organizations that and practices that had the best evidence behind them. And I think the key thing there was is that we didn't do a separate initiative around evidence. We built in incentives to come up with new evidence into the existing funding streams, which meant it was a lot more permanent and it was affecting a lot more dollars than if you'd sort of started a little, let's fund a few evaluations type of initiative on the side. So I think building these kind of incentives into core spending was I think the most successful thing. If it's okay, could I ask Neil a question? I'd like to follow up on one thing he said, because it's a problem I've been running into in a lot of our work here in the US. Neil, you mentioned the issue that if you pay providers, as long as a bed is occupied or a slot is filled, they have a strong incentive to fill every bed. And then when you have a surge or an emergency, you don't have the capacity to meet that need. And I've been seeing that problem particularly around opioid addiction treatment in the US, where there are often 3-week waiting lists to get into treatment because the way we pay providers is only when they have people in treatment. And so and we barely pay them enough to break even. And so they have a very strong incentive to keep every bed filled and to keep wait lists so that as soon as someone leaves, they can put someone else into that bed and be financially stable. And it sounded like you made some progress on creating extra capacity for meeting these kinds of surges. And I was curious how you did that.
Yeah, predominantly by funding it. So for paying to stay empty, that's really how. So in our core provision that the city provides itself, it's funded at a 70% occupancy rate. And in our commissioned provision, we fund it at around 90%. And that's what we want to do, and be interested to get your thoughts on it, is how do we incentivize a more systemic approach that both meets the needs, because we simultaneously have to respond to the needs of the individuals we've got now, but also future demand, which is a system issue. So some of the advantages of being a relatively small city is trying to get, I think you talked about everybody rowing in the same direction, and that as a whole system where providers work together, but also includes moving people on as a big part of what they do. And that's a challenge because the individual parts run as separate businesses, and it's trying to overcome that and align the funding to what the system wants rather than the parts of the system. So we've added little bits into it, but I'd like your thoughts on how to add more into that.
Yeah, and one thing I've seen successful in the US about this problem, this problem that if what you don't want to do is set up a financial incentive such that if someone is transitioned out of homelessness, let's say the shelter loses money by succeeding. I mean, that's what you don't want to have happen. And one thing that has happened in the US is in a couple of jurisdictions is in places where we were trying to reduce the use of shelters and increase permanent housing options, we've helped the same organizations be in both the shelter business and the permanent housing business. And so when the legislature was reallocating money from homeless shelters to housing services, it was staying within the same organization rather than taking money away from the shelter organization. And so by I don't know, I guess we call this vertically integrating or something, the business model there, that was one way to overcome the politics of how can you ever take money away from the homeless shelters? Well, the answer was they get to keep the money, but for a different activity.
Yeah, and I guess we've seen some of that, and maybe, I suppose, trying to go another step beyond it, because sometimes what that leads to is a bit of cherry picking. So that the providers who've got the move on accommodation, as well as the kind of filtering into it, tend to pick the people who are least costly to manage and moving on and want to hand over others, sometimes with legitimacy. But also, I think part of what our response to that is trying to develop much stronger, consistent assessment processes. So where the person is shouldn't be so dependent on who's providing it as to what their needs are, and particularly common definitions of what success is across the system. So that, and redefining around suitable and sustainable. So identifying, if we've got permanent accommodation as our aim, more consistently identifying the gap that the individual has to sustain accommodation, and how do we fill that gap. So the consistency of assessment also, I think, helps to create that. But it's difficult. Next you'll be suggesting that there should be just one state provider.
That's a huge question in itself, isn't it? And I think this is a great point at which to start asking some of the great questions coming through from the participants. So Ninish Musaya, apologies if I mispronounced your name, but he's asking, Jeff, whether, are there any ways of going beyond tinkering, contracts and performance metrics, and really focusing on what's best for the end user, people with, obviously experiencing homelessness. And this really reminds me of obviously your work around, payment by results, and is there a way of addressing some of the things the two of you have just been discussing in the last few minutes that involves actually redesigning the system around what's actually happening to people, and then obviously the services around them, us being able to work out more appropriately what's needed at any one point, locally and nationally, and closing services as and when we need them to, if we're focusing more and more on what's happening to people.
Yeah. So I guess I have 3 observations about that question, and so as you said, one way to make the system focus on the needs of the users is to have financial incentives that align with good outcomes for those the users of the system, like are people stably housed, and so to the extent that one can get the system focused on those outcomes as opposed to volume metrics, that can help meet the needs of users. I think the second thing that's an important part of the permanent supportive housing model is having social workers who are meeting the diverse needs of the individuals who've been transitioned into housing. And so having payment metrics that let social workers deliver whatever mix of services is needed and connect people to service is really important. In the US, traditionally, it's been a real challenge because our healthcare system only pays for episodes of care where you show up and get seen by a doctor or a nurse. And paying for casework is traditionally not something that our government healthcare system will pay for. And we've had to get specific waivers put in, and I think probably now about 8 or 9 states have gotten these waivers from the federal government to be able to use federal healthcare dollars for casework that doesn't have to involve a person showing up at a medical office for care. And so making that possible, I think, has been helpful. And the third thing I will say is for design of any of these kinds of interventions, spending a lot of time with the individuals you're trying to serve and hearing what their experiences are of the system, you just cannot do system reengineering if you're not spending a lot of hours with the clients figuring out what they actually need, because what you guess in your office looking at data is very different than what you discover if you get out in the field. And so I just think an essential skill in designing good policy is to get out of the office. And I I'll actually tell you a story about this from when I was at OMB. At a certain point during the Obama administration, there was a terrible oil spill in the Gulf of Mexico. And I got put in charge of assembling the congressional economic assistance package for the area that was affected. And I could not, even though I was working out of the White House with all of the US government reporting up to me through our emergency management agency, I could not figure out the scale of this problem, whether it was 10 million, 10 billion, 100 billion. I mean, it was impossible to figure out what was going on. And I finally took 3 of the people on our team and gave them plane tickets and told them to fly down to the Gulf and not to come back till they figured out what was actually going on, because there was just no way to sit there in Washington and make the right decisions and figure out what was going on.
Thank you, Jeff. And Neil, we'll move on to a question from Phil Warren. And I think this is something you're very familiar with. He mentions how Jeffrey's talk really highlighted some of the difficulties, the challenges of the way that the Ministry for Housing might allocate funding, and for all sorts of understandable reasons, because it's really difficult to work out what's the best process to allocate funding for local authorities. So in your experience, what's the right balance between direction from the center and then getting that process right, and the length of the funding that so many people complain about, and what would you say when it comes to the fact and funding mechanisms? It's not an easy thing to get right.
Yeah, I lost you for a little bit on the last point. What was your last point there?
So that balance between having to do something right now, but trying to introduce improvements for the future. What would your advice be?
Yeah, I think I liked what Jeff spoke about earlier about mixed funding programs, because there is something that has to happen in order to respond to people who are in actual crisis now, which kind of skews systems where sometimes in government it can feel like nothing succeeds like failure. So the more you do of the problem, the more money you get, and the more it can be measured. So bed and breakfast use is one of our challenges. We haven't used bed and breakfast since 2006 in Newcastle, and that restricts our funding. And so the mixed funding element, so in our case, that really positive example was the Homeless Prevention Trailblazer, which provided lots of opportunities, including some great collaboration with Heriot-Watt University that helped us understand more about what makes our system work and what doesn't. So mixed funding, and I think increasingly MHCLG now talk about co-production, and they promise that there's going to be longer term funding. As yet that hasn't materialized, but I think the co-production has worked well. So the advisors talking with us, looking at our local data, seeing our local provision, and then devising together a funding program. So I think a mixture of those 3 things, but longer term funding would be welcome, very welcome.
And Jeff, this is a real issue when it comes to a problem like homelessness. That's complex, and really it's the responsibility of many government departments. And yet, in the UK, it sits in England, it sits with the Ministry for Housing, but we know that many other departments might, and their policies might be having an impact on overall trends. What would be your advice when it comes to, what that means when it comes to developing funding mechanisms that actually work and are transparent?
Well, I guess the first thing I would say is when you find an issue area like homelessness where these government silos are a big part of the reason why it's hard to make progress, there's usually a lot of really low-hanging fruit to make things a lot better faster if you just get a couple agencies working together. And I think often the places we've seen the biggest improvement in outcomes have been these kind of systems where the healthcare agency is incurring all these financial costs because of homeless people showing up in the emergency room 6 times a year, and the housing agency, you know, is working on this problem, but doesn't have the same kind of resources that the healthcare agency does. And you get them to the table, and you come up with a solution where the healthcare agency can put some money in that allows the housing agency to move toward its objective. So I do think, you know, I look at this challenge actually as an opportunity, because it usually means things are running so badly right now that small tweaks can improve things. I also think it's a you know, it's an area where often you need people at you know, one step up from the cabinet ministers. You need the mayor, or in the US, the governor, or you need this, you know, the prime minister to say this is a priority and force people to work together, because these issues that cross cabinet agencies, you know, someone has to put this on the radar screen as something that to get people to start working together.
And we have a comprehensive spending review coming up in the UK in the autumn, so that's definitely a unique opportunity to you know, do something different, and there seems to be a willingness to do so, which is great. And from the macro to the micro again, Jeff and Neil. So from Matt Miller, he's asking about IT providers. So because I'm assuming Matt works in a local area, and they're about to change their IT provider for homelessness and housing services. So do you have any tips in terms of what to look for so that they can do more in-house data work that's effective when it comes to, you know, making limited resources go further? Neil, would you like to start?
Yeah, I think know your content. Ask, say what you want rather than assume that the computer or people have common sense and it will be able to identify what you want. So define your content and get a system with sufficient flexibility for you to be able to agilely respond without having to wait for a long time if there's fluctuations in data to get permissions from your provider to manipulate your data. So be clear about what you want and spend more time thinking about what you want than perhaps who's going to provide it, and then make sure that you've got sufficient capacity to use the data as you want. Would be my two things.
Thank you. And Jeff?
Yes, I guess I would say here are a couple of tips. I have no idea if they are relevant to the questioner's particular circumstance, but I will throw them out there. One is go with providers that promise to deliver you actual working things in stages. You know, 3 weeks from now, something's going to be working. 3 weeks later, something else is going to be working, rather than the one that's going to do a 3-year build and it'll start working in 3 years, because those you never get to that point. And so go with the agile, modular provider, I guess, is my first piece of advice. And the second one is make sure that whatever deal you set up with this provider, you still own your data and don't have to pay them to get it back. I've seen a bunch of cases in the United States, especially in labor agencies, where they've hired someone to do all the federal reporting for them and somehow wrote a contract where the government's data is now held by this private organization. And when the government wants to get their own data, they have to pay them to get it back again. And you should never write a contract where that happens. So make sure you still have your own data and the right to get it for free whenever you want it, even if someone's managing it for you.
Yeah, if I had a penny for every time, you know, people talk to me as if they thought, you know, an IT system would solve all their problems. I couldn't support more this idea that an IT system is always evolving. So making sure that it gives you all you can, you know, as quickly as possible, but then, you know, don't think that it will ever end. The job of constantly improving the system is really vital. But we'll move to a question from Phil Warren. That's an interesting one around, you know, measuring results in the shorter term, so you know you're on the right track, but at the same time really looking at impact more rigorously in the longer term. And this is something that we always think a lot about in the center, and we certainly advocate for impact to be measured across different localities, because obviously it would help address research wastage. And there's certain things that, you know, are better done independently from, you know, all the actors involved, if possible, as well. Jeff, is this something that you can maybe talk to? You know, that balance between, you know, there's a role for data and evidence, there's a role for, you know, evaluation, and how the two come together to essentially, in such a way that, you know, the whole is more than the sum of its individual parts.
Yeah, I would say two things. So one is, in some of the political discussion around the use of data and evidence, the way things get framed is as if everything's binary. Programs either work or they don't. And I rarely in the real world see the issue as being programs either working or not. It's every program can be managed to work 30, 40, 50% better. And models that may have worked in a small sample randomized experiment 25 years ago may or may not be effective in a current implementation. And so I guess the first thing I would say is I think from the standpoint of someone in the public sector trying to manage to get better outcomes on difficult social problems, the main thing you should be trying to do is get monthly or quarterly or annual performance trends going up and figuring out how to do that as fast as possible. And it's also very valuable to be funding 5 or 6 year studies that will figure out whether our program models work at all, because we wouldn't want to be spending, you know, a lot of money on things that don't work. But you can't manage through randomized experiments that take years and years to do, because we'll just never test enough things. And by the time we get the answers, we will have changed our strategy anyway. So I think we certainly need, you know, in the article you mentioned at the beginning, I think we probably need 10 times as many rigorous randomized experiments in social policy as we're doing right now. But we also need a lot more focus on what are we going to do so that the outcomes this month are better than the outcomes last month, and the outcomes 6 months from now are even better. And, you know, as a manager, that is the main thing I would focus on if I were trying to work on these problems on the ground.
And and we need to wrap up. And you know, before we do, can each of you maybe say a little bit about your top, you know, wish list? You know, 2, 3 things that you would ask, you know, the government to do in the next few months and years, which will be quite decisive for the types of things we're talking about. Maybe Neil, let's start with you.
Yeah. Okay. So I think that obviously longer term funding is a priority, and I think funding that relates beyond crisis homelessness. I think there's quite a skew that becomes a little bit of a self-fulfilling prophecy. If you pay for crisis, you get crisis, and rather than sustainable homes, I think some of those kind of mixed economy type examples that Jeff talked about, some of those things that respond to crisis now, but also learning and having innovation built into the system to create greater degrees of preventative work, and within that, pilots that bring together the state, because I suppose it might be too wishful a list if we said, can we have everything joined up? But if there are pockets that are joined up that relate to local need, I think we've had a very successful partnership with our local job centre that deals with employment issues, and building on that so that we can then test further. I think probably the priority area for us that we would like government to fund a stronger aligned approach would be people coming through the asylum process, which is incredibly fragmented and dysfunctional and seems to cost a lot of money and unnecessarily damage individuals and communities, because it's a national programme that isn't aligned to local needs. So it's that alignment issue and longer term funding.
Thank you, Neil. Jeff.
Oh.
Jeff, you're on mute. Sorry, I made it through 59 minutes without messing up. All right, I want to go with one targeted idea in homelessness, and then I'll go broader as well. On the homelessness front, the project I would most like to find a government to work on with is a government that would say that every time someone shows up in the system as the first time as homeless, something must have gone wrong. And let's go treat that as something we need to diagnose the same way that if you were in a hospital and the surgeons would have their weekly meetings about every time a patient died, they would say, what do we have to do to prevent that from happening again? I would like government agencies to say, how is it that someone showed up as homeless in the first place? Was it bad discharge planning at the jail? Was it was it domestic violence and we're not doing enough to come up with transitional housing for victims of domestic violence? And would systematically basically say, we're not going to accept any new entries into homelessness because we're going to go plug all those entry points with adequate services. So that would be my dream within homelessness. My broader dream is that in order to create incentives for better outcomes in social services, we need feedback loops where voters hold elected officials and accountable for doing better on these in these areas. And so we need an ecosystem of journalists and universities and other players who are actually measuring things well enough that you can tell when a mayor is doing a good job and when a mayor is doing a bad job, so that there's accountability and there becomes a lot more incentive for the leaders to want to adopt these effective practices because they know that people will be able to notice when that if they make things better, it'll be obvious, and if they don't, it'll be obvious as well.
Thank you so much, Jeff. Fascinating session. So it's pretty clear that there are many opportunities to improve our data and evidence work, building on all the great stuff that has been done to date. And as the problems in the UK and elsewhere increase, leaders at all levels with the world to embrace the movement for evidence-led policy making and practice. So we got off week 4 to a great start. Thank you so much, Jeff and Neil, again. And thank you to all of you who've joined us online. Sorry that we didn't have time to answer all your questions, but remember to keep the conversation going using hashtag CHIFest2020. We can certainly address any other questions there. And do join us in a few minutes if you can for the opportunity to hear from another brilliant speaker, activist and author Terence Lester, who will be speaking about his anti-poverty work and the organization Love Beyond Walls, as well as his experiences of homelessness. Thank you, everyone, and we will see you again soon, we hope. Take good care.
Thanks. Bye.